Hi everyone, I'm Priya Mistry, the TMJ Doc, and today I'm going to talk to you about tinnitus or ear ringing and TMJ disorders. I can't tell you how many people have reached out to me asking me why I generally don't talk about tinnitus, how it's connected to TMJD, what causes tinnitus, if our treatment resolves tinnitus, and more. I'll admit to sitting on those questions for a while, and I finally decided to make this video about tinnitus, even though I do not have all the answers about this very confusing and sometimes debilitating condition. That being said, if you're looking for more information about TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Hit that subscribe button as I post a new informational video every Friday for people who are suffering from TMJ disorders. For those of you who don't know me, I'm a general dentist with a practice dedicated to taking care of patients with TMJ disorders. I practice in Portland, Oregon with my mentor, Dr. Arthur L. Parker. Please be sure to follow me on Instagram as I post about TMJD quite frequently. My Instagram handle is _TMJ_doc. Please also follow me on Twitter, tweet. My Twitter handle is @PriyaTMJ, and I will admit to not being as active on Twitter as I am on Instagram. On my social media accounts, I post lots of useful information about TMJ disorders, tips, trivia, hints, information, muscle releases, etc., things that you can do at home to get some relief. So please be sure to follow me on social media if you like to nerd out on TMJ information like I do. So let's get right into it. What exactly is tinnitus? According to the Mayo Clinic, tinnitus is when you experience ringing or other noises in one or both of your ears. The noise you hear when you have tinnitus is not caused by an external sound, and other people usually cannot hear it. Tinnitus is a common problem that affects about 15 to 20% of people, and is especially common in older adults. The noises associated with tinnitus can range from a low roar to a high squeal. What causes tinnitus, you ask? The causes of tinnitus are vast and varied and include, but are not limited to, hearing loss, ear infection, ear canal blockage, head and neck injuries, medication, Meniere's disease, eustachian tube dysfunction, muscle spasms in the inner ear, TMJ disorders. Yes, TMJD can be a cause. Blood vessel disorders, ear bone changes, diabetes, thyroid problems, autoimmune disorders, and more. This is what makes tinnitus one of the most complex symptoms that I ever see, and it sort of leaves all of us TMJ dentists sort of confused on how exactly to treat it and get predictable results every single time. Many of my TMJD patients do not have tinnitus. Of the ones that do have tinnitus, some have reported that the tinnitus was present well before the other TMJD symptoms started, and some have said that it came on at the same time that the other TMJD symptoms came on. For some of our patients, that tinnitus is debilitating, and for others, it's very manageable. So what's the solution, you ask? Well, my friends, I can't tell you how much I wish I had one for you. The main reason I've stayed away from talking about tinnitus is because we have yet to find an effective treatment modality for it. Tinnitus is the one symptom that has proven to be highly unpredictable in terms of how it responds to our treatment, which consists of custom orthotics, myofascial release, and osteopathic manual jaw manipulation. We have seen tinnitus get better for a very few number of patients, but mostly it remains unchanged throughout our patients' treatment. We are very upfront about this from the first appointment, as we never want to create false hope about solving or getting rid of someone's tinnitus. I truly wish I had more information about this symptom, which for some people can be truly debilitating. So that's really it, my friends. If you liked what you heard or you learned something new, click like below, subscribe to my channel, do all the things. As always, questions and comments are welcome. And remember, my friends, you can never have TMI about TMJ. Thank you.